Welcome to today's webinar on One Health and the COVID-19 pandemic. This webinar is first in a series entitled Reconnecting for Our Future, hosted by the Lancet One Health Commission. I'm Dr. Lorenzo Guinto, joining you from Manila. I'm a Filipino physician, recent Doctor of Public Health graduate of Harvard University, and the Commission's Next Generation One Health Advisor, and I will serve as today's moderator. The purpose of this webinar series is not just to raise awareness about One Health, but also in the spirit of co-creation to stimulate a global conversation to feed into the Lancet One Health Commission's evolving work. This webinar series is organized by the Center for Global Health at the University of Oslo, together with the Amuasi Center for Collaborative Research in Tropical Medicine in Ghana and the Center for Global Health at the Technical University of Munich. Before we start, I just want to make you aware of a couple of things. When you registered, you agreed to the session being recorded. The link will be later made available to those not being able to attend. All participants' microphones and videos will remain inactive throughout the session. This 1-hour webinar will begin with a conversation between our panelists and myself for around 30 minutes, to be followed by a Q&A session. To our participants, you are invited to type in your questions either with your name or anonymously using the Q&A button, and I will be reading them to our panelists. Today, we have almost 400 participants from around the world registered, and we are also joined by several expert members of the Lancet One Health Commission. Welcome to you all. Let me introduce to you our panelists, who are the co-chairs of the Lancet One Health Commission. John Amuasi, who is joining us from Ghana, is the head of the Global Health and Infectious Diseases Research Group at the Amuasi Center for Collaborative Research in Tropical Medicine, or KCCR, and is also a lecturer at the Global Health Department of the School of Public Health at the Kwame Nkrumah University of Science and Technology, or KNUST. Dr. Amuasi's work involves policy and field epidemiologic studies on diseases of poverty, and he has also consulted for several international organizations on interventions to improve health systems, services, and outcomes in sub-Saharan Africa. Andrea Winkler, who is joining us from Germany, is a professor of global health and specialist neurologist. She is the director of the Center for Global Health at the University of Oslo and a co-director of the Center for Global Health at the Technical University of Munich. She has worked in and with Africa for the last 20 years with an emphasis on poverty-related parasitic diseases using a One Health approach, global neurology and mental health, and digital health. John and Andrea, welcome. Let's now begin this, what I call a transcontinental conversation. COVID-19 swept the world in a short period of time. In fact, today, we have passed the 3 million mark. This pandemic is pushing us to engage in deep reflection and conversations such as this one we're having. Before we even go directly to the links between One Health and COVID-19, many of our participants today might already be working within the One Health space. But for the purpose of those who might be hearing the term for the first time, can you briefly tell us what One Health is all about? Maybe Andrea, you can start.
Well, thank you, Renzo. Thanks for being with us, and thanks also for guiding us through this discussion today. And I'm very proud to be together with John, my partner in the Lancet One Health Commission, and a very dear colleague. So, Renzo, One Health. I mean, this term may seem to be rather new, but in fact, it's actually not. It has been long recognized nationally and globally, actually since the 1800s. Scientists, especially vets, have used this concept to mainly refer to human and animal medicine that was pretty much practiced separately and also in silos, which it still is in a way until the 20th century. So the fathers of the One Health concept, I think we can agree that these are the veterinarians who look mainly at the interaction of animals and humans. And so the complex here is more like a zoonotic disease complex that they were interested in. Now, very interestingly, when I talk to my vet colleagues, and I've been working with vets for a long, long time, they say they're very happy that the One Health concept, in a way, experiences a rebirth together with us human doctors, because vets usually lack the entry into the big salon of One Health and global health. So the human health people, they can work also as door openers. So basically, the vets come with their experience, with their concepts, and also with their experience from the field. Now, of late, the environment, also of course sparked by the climate change, etc., has entered this concept. And these days we talk about a Venn diagram with 3 circles, so human, animal, and environmental health. And we are very much interested in the overlapping area. So it's where everything is interconnected. And
how about you?
Oh, yeah.
Yes. How about you, John? Do you have anything to add to that, overview of what One Health is all about?
No, thank you very much, Lorenzo, and thank you to you, Andrea, for really setting that ball rolling and taking our cherished listeners through what One Health is about. I think it's important to understand the history of One Health and where we're coming from, because that helps us to see where perhaps we could have failed in really taking full advantage of the potential that One Health has in helping us to live in a sustainable or sustainably healthy, on a sustainably healthy planet. I want to come at it from the angle of even the well-accepted, time-tested WHO definition of health, where you think of, complete state of mental, physical, and social well-being, and looking at it even more from the social side of things. We have become so disconnected from our environment, which includes animals and plants, and created some kind of a normal, which is really an abnormal. So you hear of people saying, we can't wait to get back to the normal. But the truth is that we've been living the abnormal for quite a while. And when you think of One Health is really should be the normal state of things, whereas there's that synergy and that balance, which ultimately allows all species to be able to live and thrive to their maximum capacity within what the environment can contain. So I think now more than ever, it's so critical that we take a step back and ask ourselves, how have we been looking at One Health? How have we been doing One Health? We recognize it's about animals, about humans and the environment, but have we perhaps looked at these as separate entities, or have we just looked at where these 3 meet rather than looking at the whole 3 of them holistically? So I think this is going to be a great session, and really looking forward into the questions that our audience would pose to us to really try and expose the potential that One Health has for all of us. Thank you.
Thank you, John. And it's important for our audience to actually be on the same page. What is this One Health that we're talking about? And yes, it is the Venn diagram that Andrea was referring to, but also John was, telling us that, really the natural state is where, animals and humans and the environment all live in perfect harmony. So how can we go back to that natural state that you're referring to? And so I guess the question is, now you are the co-chairs of the Lancet One Health Commission. Can you tell us what the aim of this new commission? What should we expect to come out of the commission? What's your mission? What's the mission of the commission, especially when it comes to One Health? John, you might want to start, or Andrea?
Yeah, I can start with a bit of text. I understand John will show us a diagram. So if I just quickly maybe introduce. So the aim of the Lancet One Health Commission is really to make a case for One Health. And as John very rightly said, It's about, we know that we are connected, but we have lost this connection somehow on our way through the centuries, and in a very selfish way, you know, in a very anthropocentric way, which not necessarily is a bad thing to think in an anthropocentric way, but it has been the selfishness at the expense of the destruction, of course, of the environment and our dear planet. So it's about a synthesis of evidence to support the One Health concept in enhancing the health within a shared environment of human and animals. That is the overall definition. And then more closely, we would look at different aspects, and always having an angle of the infectious disease perspective, also the non-communicable perspective, and the antimicrobial resistance perspective. And John will explain more when he shows our nice diagram. The Commission also wants to make a point about how One Health can be operationalized. I think this is very important, about policy translation, about good governance and leadership, about digital health, community engagement, and also gender equity, just to name but a few. And herewith, I would just like to hand over to John, because I think showing the circle, or our figure with the various circles, is actually will very nice picture what the Commission is all about.
Great. So John, maybe you can share this circle that Andrea was referring to.
Certainly, Lorenzo. I'll just go ahead and do that right away, because I think it's going to help us to get a good view of how we are thinking about One Health from the perspective of the Lancet One Health Commission. So you should be able to see on your screens now a circle which depicts, you know, the concept that we want to put forward, and really is defining the kind of work that we're going to be doing as a commission. So in the circle, you would see one at the very top, which is called the shared environment. Now, in this shared environment, you would realize that you have wildlife, you have companion animals, you have agriculture, and then you have a human being and plants as well. Now, it's interesting to note that you find this human beings and animals within each of the two other circles, which are the shared medicines and intervention circle, and then the safe food and food systems circle. What we're trying to do here is to move away from the traditional concept of having, you know, a circle which is, you know, your animals, a circle which is your human beings, and a third one which is your environment, and really recognizing that human beings and animals together with the plants and everything are intrinsically interconnected. So even in our thinking of how we can do One Health and make things really work, take full advantage of the potential of One Health, we want to maintain that tight bond and that connection between human beings and animals. So we start off with this shared environment, really pointing out how cardinal the environment is here. We exist within the environment. We are not out of it. So both the human beings, the animals, and the plants themselves, you know, are part of the environment. We are all upon this one earth. And with the shared medicines and interventions, it's our recognition that, you know, we have several drugs that have been used to treat a number of conditions in human beings, which originated actually from animals and from agriculture. You can think of praziquantel, you can think of ivermectin, and several other what we call wonder drugs. And we recognize that there's a lot more potential for human health to benefit from some of the practices, the experiences that we have from animal health. And even today, more than ever, we recognize how the health of animals, even if it's wildlife, is so intrinsically connected to human beings. And of course, there are diagnostics and other interventions which have worked in animals, which we now realize can work in human beings, and definitely the other way around. We've had stories of how surgeons, human surgeons, have had to be called in to do very, very specialized surgeries on particular animals in very innovative ways in collaboration with very experienced veterinarians. And then the third one is the safe food and food systems, which is really speaking to two things. One is the fact that the food has to be safe. Issues of food poisoning are still a big issue globally, and we do hear of things like recall of batches of food and how this can extend widely. You consider a situation where you have the recall of, say, some peanut butter or some tainted food in the US or in Europe, and a lot of this is often exported to countries all over the world. I mean, how do you recall, a couple of bottles of peanut butter from Ghana when it was manufactured in the US? Perhaps that recall may not even reach our ears here in Ghana or somewhere else in the world. And the food systems is really about the processes and the ways and the supply chain that we currently have of food, which very unfortunately leads to massive amount of waste. So just to quickly wrap up on the circle, you will notice that each of these circles has non-communicable disease, antimicrobial resistance, and infectious diseases enveloping each of these. Now, the idea is that we want to examine each of these three circles within the sphere of these three major areas, which is NCDs, antimicrobial resistance, and infectious disease. And I think, Lorenzo, if you could allow Andrea, when I'm done, the opportunity just to speak a little bit more on our non-communicable disease twist to One Health, because this is really innovative in itself. So each of these will be looked at through this, and then ultimately we've got to express One Health. We've got to be able to do One Health. We've got to be able to show that it works. And we are positing that we can do this by making sure that we express One Health in health systems and surveillance, through gender, community, and equity and ethics, through policy and legislation and governance, which will be put forward by knowledgeable leaders. And then also want to make sure that we are integrating digital health, Andrea already touched on that, evidence and prediction using big data for humans, for animals, and big data even in plants. And then finally, you've got to make a case to show that this really is your best bang for the buck and that it's worth the money. So in short, that's what I'd say our concept is about. And we're really looking forward to engaging with our commissioners and the write-up, which will really explain the way we think the world should go when it comes to harnessing the full potential of One Health.
Great. Thanks, John. And I think our audience is, now, more than thrilled to read the report, the future report that will come out of the commission, having seen that basically redrawing of the traditional Venn diagram of One Health, and making sure that, I think one term that came to mind when I was listening to you is adopting a multi-species consciousness, that it's not just about, we humans and how the animals are affecting us or, killing us or, transferring diseases. I even noted that in your listing, animals are first, and then environment, and then humans. So, which is, again, not the usual way we describe One Health, where it's about humans first, and then everything else comes next. So I'll pivot a bit and move to what probably or surely is in every person's mind now, which is COVID-19. And Andrea, you talked about a while ago the need for One Health to be operationalized, because maybe for some people it's still an abstract concept, and it's harder when it comes to how do you actually apply it on the ground for problem solving, just like solving problems, just like the pandemic that we have. So my question is, how important is One Health to the ongoing crisis? And perhaps you can give, concrete illustrations of how the One Health approach was and continues to be useful in the ongoing COVID-19 response so far. So anyone can start.
Sure, Lorenzo. I may start maybe with the China case, and then John, I'm sure, has great examples from Africa. I think we need to be rather clear that we need an approach from now for the crisis, for the pandemic, but we also need an approach, and I understand we're going to touch on this later on, for the post-COVID era. To basically draw on lessons learned and to prevent, or at least contribute to prevention of further epidemics. So, and not just remaining with the actual crisis, we had a webinar last week, and some of the listeners, some people of the audience may have been part of the webinar last week, where we talked about wild animals and wild places, and where we had Dr. Chris Walser from the Wildlife Conservation Society with us, explaining how the link between animals and humans was crucial for the virus to set off. And this brings us really to the wet markets, not just in China, but now specifically in Wuhan, where the disease, where COVID-19 took its origins. But that, of course, I mean, wet markets is not just an issue for China. It's around the world, and not the least also in Africa, although there are very distinct differences. And I shall not dwell on this, because this is what Chris has already elaborated on. Just by the way, for our audience, we do have a link, and this webinar can also be re-listened to. So here we are, One Health, the wet markets. Wet markets are an awful place. Animals are cramped, they are in agony. There is blood, there is feces all over the place. Animals of different species are on top of one another. I think I would never want to be in a market like this. But this is just how it is. And this is just, I think, the perfect mix and the perfect environment. We also know that there is a very good agreement, a very good genetic agreement in terms of now SARS coronavirus 2, looking at bats and the virus now that is causing COVID-19, that originated in a special location at Wuhan market. And this has also been confirmed in various publications. We are not so certain about the intermediary host, but that of course is for other people to look at and to sort out. So this is a very clear One Health aspect. It's about bringing wild animals into the environment. They are not where they shouldn't be, where they're not used to be, very close to humans. It's about our encroachment, also urbanization, this destruction of forests, you name it. So that, of course, is much, much larger. When we know that this is so crucial to pandemics, and not just to that one pandemic, we know that in China that there are other places, not just China. I think we should also refrain from this blaming and shaming of China, that there are actually viruses popping up ever so often that are just contained, and it doesn't even reach the public. We need to think very, very seriously about really closing markets like that through legislation, and that also is a One Health approach. So basically legislation that needs to follow suit when we know that this is where the virus originated, and then how to make this legislation sustainable. There's much more to it, but I just hold my breath for a while, and we'll hand over back to you, Renzo, and also to
Sure. But maybe, John, you have something to add when it comes to the tightening of the human-animal interface, as well as other aspects of the COVID-19 epidemic, where One Health really manifests its importance.
No, thanks for that, Lorenzo, and thank you very much, Andrea, for really also going into this important recognition of how COVID-19 really perhaps is that pivotal point that demonstrates how One Health is very critical today, now more than ever. You touched on the wet markets in Wuhan, and beyond the wet markets also is the whole idea of the way in which humans interface with animals generally, and our ability to be able to identify and pick up quickly when there is disease, be it in humans or in animals. Now, so far, we have tried to develop pretty sophisticated global surveillance systems for human illness, also for animal illness, I'm aware. But it is clear that the surveillance for human illnesses and the capacity that we have goes way beyond the capacity that exists for detecting the same in animal species, and more particularly even in the wildlife species. So one thing that we should be able to take away, and one thing that really is important for us to consider, is being able to expand our global surveillance capacity beyond just looking at human illnesses. And already there's so many loopholes in this global surveillance system for humans, but also to co-expand that with the global surveillance for animal diseases, and with a particular emphasis on wildlife species because of the risk of the spillover. Now, what happened in Wuhan, you realize, was a wet market where wild animals that would ordinarily be in the wild, had been put within a market, which is a human environment, a human settlement. But what about places where humans naturally interface with animals? You're thinking of forest areas. Think about the Amazon in South America. Think about the forests in the Congo and the central part of Africa, where humans are constantly interfacing with wildlife and wildlife species. How can we set up a global surveillance system that can pick up on all these things? And I want to move away from there and speak about how this plays into the whole issue of international trade. If you look at the trade between China, say, and Africa over the past couple of years, it's been going up and down a bit, but even 2019 alone, it went up by about 2.2% to about $208 billion trade going between China and Africa. The Chinese president, His Excellency Xi Jinping, made trips to Africa, including Ghana, in 2019. Several bilateral agreements were signed, a lot of aid coming in from China to many African countries. Now, this has a lot of serious implications because you see the Chinese population in Africa burgeoning. And naturally, given the culture and everything, there is appetite for different kinds of food and different ways of interfacing with animals. And so animals which otherwise may not have been targeted by other people, by locals, now become consumable by our Chinese colleagues, who we're all too happy to work with, but I'm just trying to explain how things work. Just like how I may express my culture when I'm in the US or elsewhere and try and live my culture out there. It's the same way when our Chinese friends come over, they try to live out their culture, but there are implications which we need to be ready and be aware of. There's a huge traffic of animals that moves from Africa to China. You can think of the pangolins and others, huge volumes of these. These have implications. What that can mean is that a virus could actually emerge in one part of the world, Africa, South America, wherever, and move to China and cause an outbreak there. I'm not saying this was the case with COVID, not by any means, but I'm just explaining that we need to look at this holistically and understand how this ties in with global trade and international relations.
Great, thanks, John. And from both of your remarks, there are a lot of questions and aspects to the how can we actually make sure that there's an integrated One Health response. You mentioned surveillance, but there's also the role of global governance and national policy legislation. I just want to inform our audience, there's actually a convention on international trade in endangered species of wild fauna and flora. And, it seems that we already have some of these instruments that, but now COVID-19 is in a way a wake-up call to actually revisit these instruments and see how can we strengthen their implementation, but also how we can rally the One Health community to be more vigilant, but also even work towards a more preventative measures, not just waiting for the next virus to erupt in anywhere in the world. So I just want to remind our audience we have around 30 minutes remaining, and I'm inviting them to ask their questions, put them in the Q&A button that they can find in their screen. And before I read the first question from our audience, I think one question that I also want to raise to our panelists here is, we've read the news. It seems that the virus will be staying with us for some time. But we are also hearing pockets of good news in a sea of not so good news. Yesterday, New Zealand announced that it already won the battle against COVID-19. Some vaccines currently undergoing clinical trial are showing some promise. Indeed, there is hope for the future. I know you will be discussing this a lot within the commission in the next few months. But at the top of your mind, how can we advance One Health as an approach, as a field, as a community in the post-COVID world? And I want to link one question from our audience to this theme. One member of the audience asked, what do you see as the two most important areas for future research on, COVID One Health issues? So, these are some post-COVID questions that are already being asked. Anything at the top of your mind, Andrea and John?
Okay, I can try to answer that, but also to answer your question, Renzo, about the post-COVID era and how can we harness and how can we advance One Health. Actually, the whole question about how can we advance One Health, how can we harness it and how can we move it through so that we have lessons learned and can prepare and prevent after this pandemic is already a field of research in itself. Look at the governance issues as the policy issues that we need to establish around the One Health concept, who to bring on board, who to talk to, who to engage with. So these are very, very important questions, and how to best do this. And for example, what we have done recently and what others have inspired us to do is actually to harness what's happening now with COVID-19 and also the paradigm shift that we realize is happening, and putting those ideas into new coalitions. There has been a COVID-19 clinical research coalition just recently been founded by Nick White from the UK with an emphasis on low and middle income countries. And that has actually also sparked the idea within the commission, and especially between John and me, to launch a COVID-19 One Health research coalition, where we would like to now also accept it for publication by the Lancet, where we would like to reach out to the community because, and this is a paradox, but the One Health community is also working in silos. So they are also working in silos. There are quite a few networks. There are many things going on in parallel. So it's about really getting this community going and how best to govern that. That in itself is already a big research question. I stop here.
Right. I just want to add, there's actually one person from the audience who even noted that there are already tripartite agreements existing between FAO, the Food Administration, WHO, and OIE, the WHO of animals. But there's really limited interaction happening on the ground and operationalization. And so there really needs to be some action in terms of strengthening multi-sectoral approaches and governance. And then I have a question, and maybe, John, you can answer this. How has education of the One Health concept been handled so far? Especially in African communities, you already talk about, the One Health challenges in Africa. It just happened that the virus came from China, but Africa is not immune to, in other parts of the world, no one is immune from being the ground zero of the next epidemic post-COVID. So how are we making sure that communities and professionals are receiving One Health education?
Well, thanks for that, Renzo. One Health has become pretty prominent over the past, decade, and more importantly, over the past 5 years. And you would realize that post-Ebola or during Ebola, there was even a greater realization or recognition of the need to accentuate One Health in a very unique way. Ebola epidemic was largely limited to a few countries within Africa, and it didn't touch the world as deeply as COVID has touched the world. In fact, so I'd like to say COVID is not just a global pandemic, which is caused by some zoonotic agent like the SARS-CoV-2, but it's actually now joining just a few select episodes in recorded history and represents a pivotal point in modern time, as Andrea mentioned earlier. And the unique feature of this world-changing event is the fact that its origin is at the human environment animal interface and then rapidly exploded largely as a result of human interconnectivity and our mobility, great mobility, and global trade. Now, it's difficult to even imagine how our world can go back to the levels of mobility that we had last year, just a few months ago. It's very difficult to even imagine that we would be willing to be as mobile as we had been in the past. So thinking about that, it means that the way in which we do One Health, express One Health, teach One Health has to change. We cannot continue with the usual paradigm where the couple of courses on One Health, or we have what we call One Health specialists, and so on. So One Health has to be a movement. It has to be a way of life. It has to be something that transcends all our activities. And this is exactly why Andrea made mention of our mooting of the idea of a One Health, the COVID-19 One Health Research Coalition. And the idea behind this is to reinvent from the highest levels through to the really operational levels, how we live, reinvent how we do One Health. So this will really involve putting One Health, I wouldn't say at the center, but making One Health considerations in every aspect of our lives as individuals, at the country level, and also at the international level. You made good mention of this tripartite agreement, or the tripartite relationship with the WHO, OIE, and the others, FAO. And now this is very critical, needs to be strengthened, and we do actually invoke this this existing tripartite agreement in our proposition for a COVID-19 One Health Research Coalition. So I think beyond thinking about how we have taught One Health and done One Health, rather we need to take a step back, recognize the cardinal role that One Health plays, and really reinvent the way in which we do One Health.
Right. It sounds to me that you're actually calling for a cultural movement around One Health. You know that, and it's interesting. There's one question about, the concept of One Health professional. Do we actually expect a One Health professional to be a veterinarian, a medical doctor, and environmentalist at the same time? And you just spoke to that question or a remark by saying that it's multidisciplinary and it's more of a frame, an additional frame for education of professionals in the post-COVID world. There's a lot of.
Can I touch on one thing? I think what you said just jogged my mind right there, because I have always cringed at that idea of a One Health professional, a One Health expert. It's just like, for me, saying that you have somebody who is a science expert and expect that person to be a great chemist, great physicist, great biologist, great social scientist, and all that. It just doesn't work that way. It's much the same with One Health. One Health is bigger than just having a One Health professional, an expert who does One Health. And this is really what I'm talking about and I think you got it right there, trying to move away from this way in which we've done health to recognize that it's much bigger and requires a lot more.
So I'm just wondering, in the Lancet Commission, are you going to make the final decision on whether One Health a discipline, a field, a community, a movement, a frame, an approach? There's so many words associated with the term One Health. Or is it actually the beauty of One Health? Because there's a diversity of perspectives and interpretations depending on how it suits them. Andrea, do you want to?
Yeah, sure. If that was a question, yes. I mean, One Health cannot be a discipline. Otherwise, it would defy its own essence. One Health is a mindset, or could be an approach, a movement. It's how collaborations are viewed, and basically also to be brave enough. And that goes now for all the different disciplines in our world, be it in the medical field, be it in the broader health field, you name it, in the biodiversity field, is you need to be brave enough to step out of your own comfort zone and basically listen to what the others have to say, and then see whether there is a joined path that can be walked. And very often this is the case. And if you walk this joint path, you can be much more powerful by just walking on your own. But having said this, we are not saying, I think no one says that we now gonna trash all what we've learned about science methods and disciplines, being doctors. All of that, of course, is most valuable. And I've also encountered on my One Health journey, I've encountered people who actually get a bit frightened when we talk about One Health, because they think that things and that knowledge, expertise, and methods are watered, are taken away from disciplines. And I think we need to be very clear that this is not the case, that this knowledge is really valuable. It's about reaching out and having joint questions. And basically it's our very own existence and that of our planet that is at stake. So though it's a movement, it's a mindset, and you have to have an open mind to have a One Health mindset.
Thanks, Andrea. I have one question from your fellow commissioner who won Le Bron. To both speakers, in your view, where should surveillance begin? If we believe that tackling the threat at source is a cost-effective strategy, how best to support those that are working on wildlife, in the environment sector, livestock, market interface? So that's the question. Who wants to address that?
John?
That's fine. I can give that a shot. No, so Juan, I think you may be even better placed than myself in answering this question, but no, I think it's really great that you can ask this so the audience can benefit from the relevance of this question. I think I touched on it very briefly in some of my comments regarding surveillance, but you specifically mentioned what I had also highlighted, which I think is missing, which is surveillance at the level of wildlife. We have systems that have been set up for human surveillance, which have issues already because they are fairly weak in different parts of the world and unable, especially in places where they're needed the most, to be sensitive enough to pick up quickly enough when there has been some spillover from animals to humans, which is already spreading pretty fast. That being said, you want to think of the animals as well, maybe even three different categories of these. One being the animals which we have with us as as pets or as farm animals, and the potential issues with illness that could spread from them to us. You can think of swine flu, for example. I mean, we're talking swine here. These are pigs. These are farmed animals. They're not some wild animals somewhere in the forest, which people go and catch and then diseases spill over. So that's one issue where there's a need for increased surveillance at the farm level, at the human, farming level. And then think about those wild animals which are transported from forests by people who catch them to markets. So you're moving these animals from a level of very low concentration of humans to a high concentration of not only different animals, but also human beings. And this is where I think the rubber hits the road. So can we, because, well, I'm going ahead of myself, but can we institute a system where there is increased surveillance at some of these markets and wildlife places where we interface with human beings with high concentration? Can we accentuate this in the now? Because I honestly do not see wet markets disappearing immediately. I don't even know whether we have the right to say wet markets should be banned or should be done away with. We're talking about centuries of people's culture, and I really think we should respect this. I think culture is dynamic, and people are willing to change culture when they realize that it doesn't help the health or the risks maybe outweigh the benefits of upholding the culture. But cultural change comes pretty slowly. So rather than the rush to ban these wet markets and all that. I would rather that we focus on increasing surveillance in those places. And then the third part would be the surveillance at the level of the forests and the wildlife parks and the reserves and these other places. I don't know how exactly this can be done because I'm really not an expert in this area, but we're clearly lacking in having strong enough surveillance at the wildlife level, at the forest level, to be able to quickly pick up, even by, not even pick up diseases that have jumped into humans, but pick up viruses and other pathogens that could potentially be harmful to human beings. A lot of work has been done in this area in terms of just, catching animals, trying to find out what viruses are in there, but not in a systematic way that fits into a surveillance framework.
Thanks, John, for the. Do you want to add something, Andrea?
Yeah, I would like to add, of course, I fully concur that it's really the One Health collaboration on the surveillance, but also two things I think need to be mentioned as well. It's about the community engagement. So if you don't have the buy-in from the communities where the diseases break out, where they happen, then you are less likely to get the information. So it's about community engagement, about co-creation, about education, and knowledge integration. And then it is also about how to bring the information. So if you have an observation in a wildlife in a wildlife park, and you have an observation in a livestock somewhere 2,000 kilometers away. So how do you bring the information together? And I think this is where digital health comes in, and this is where surveillance systems have to be established at a level where you can really feed in very, very fast that information that then is collected as a central point. So the information is then fed to the authorities in the fastest way possible.
Thanks, Andrea. And in your remarks, in both of your remarks, I've been hearing a lot of reference to the importance of community engagement, One Health challenges being deeply intertwined with culture and economic activities. And what came to my mind is that I guess we need also more involvement of social scientists, anthropologists, people in law and policy and economics in this One Health movement that we hope to create and expand, especially in the post-COVID world. I just want to shift gears a bit away from infectious diseases. We have a question here, which I think was triggered by that circle that John showed to us a couple of moments ago. Can you expound further on the focus of non-communicable diseases in the One Health approach? I will be happy to learn more about NCDs and their links between animals and humans. So maybe John, you can start because you presented the circle, and Andrea, feel free to add.
John, you have to unmute yourself. You're
John,
muted.
please unmute your microphone. Or maybe Andrea, you can start now.
Oh, that's all right. I'm on now. I had been muted by the host. So, Andrea, I think you'll be best suited to answer this because really this whole provocative idea of NCDs in One Health came from you. And I was quite shocked when you brought it forward at first. But you managed to come. I'm totally sold out to the whole concept. And I'm really glad you have an opportunity to share this with our listeners.
Yeah, no, thank you, John. And I have to say, I have a soulmate somewhere out there, which is Barbara Netterson-Horowitz. She may be in the audience. She really has sparked this idea to bring in the non-communicable disease aspect in the One Health Commission. So just to give, I think it's always important to give very concrete examples. There is a bit of data out there already, but it's not enough. If you have people who suffer from mental illness, you may have a person with already a cognitive decline, but that person is still okay with everyday life. So there is a a time delay of a couple of years to 10 years plus from mild cognitive or minimal cognitive impairment to full-blown dementia. Now, dementia is very costly. It's devastating to the individual, to the family. It's very costly. And it has shown that, for example, people that are interacting with animals on a pet basis, but also animals that make them exercise, that you can push that limit to fully blown dementia. You can also help people that are depressed. There are animals around, and this is so fascinating, and this is really evidence, scientific evidence. They can sniff cancer in their owners. They can, and we have known for a long time that animals can actually sniff blood glucose levels and thereby help their diabetic owners to go through the night without having to nonstop measure their blood glucose. So there are various examples, and of course non-communicable diseases, cardiovascular, and exercise. So where do you exercise? Very often you exercise in the environment. So there are multiple entries into that NCD or non-communicable disease and One Health approach. And last but not least, it's all the policies and the good governance around non-communicable diseases. You name it, smoking, bad drinking habits, air pollution that has now clearly been shown to also increase cardiovascular risk through chronic inflammation. So there are various entry points where One Health could add great value. Thank you.
Thank you. There are a couple of questions pertaining to communicating One Health to politicians, policymakers, people in government. And it tangentially touches on some of the concerns a while ago about, policy and implementation failures. On one hand, One Health sounds like a fresh new idea, but as Andrea already mentioned, it's been there for ages and centuries. And so how can we better communicate One Health to especially those who are signing the bills and approving the budgets and making it, ensuring that things are implemented on the ground? Is COVID-19 not enough a narrative for One Health's case? Anyone can start.
John, you're muted again if you would like to start. I can also start.
Yeah, sure.
Yeah. So the interesting thing, Lorenzo and John, is that, but I mean it in a positive way, what I say now, is that the One Health concept that was very strictly defined early on has been hijacked by quite a few different scenarios. One scenario is called like the interministerial collaboration. So if you now use a One Health approach, it means that the Ministry of Defense talks to the Ministry of Health. Hopefully now in this pandemic situation. So One Health also means that we want to work in a multidisciplinary way. Also in a cross and transdisciplinary way, but also in an interministerial way. So to basically have a joint dialogue and move into the right direction of governance of One Health, and last but not least into legislation. So One Health does not, I think we have moved away from One Health just meaning animal, human, and environment. Of course, it's very inherent. But it's meaning much more. And if you would like to move into politics, it could also mean that this is a support for multilateralism. So don't just stay within your own nations, but open up and just embrace multilateralism. That of course is inherent to our EU thought. I stop here, and I would like to give John also a chance to answer to that important question.
John?
Well, thanks for that, Andrea. Sorry for the technical challenges. So I think in being able to communicate One Health to policymakers and authorities, it goes back to what I was trying to explain earlier, especially in our circle and the outer circle, where I was trying to suggest that we need to have a different way of expressing One Health, so that we may not really need to even explain to policymakers and authorities that there is this special One Health approach, but really to bring the thinking, which is a One Health way of thinking, and proving with evidence that really this is the way we should consider things. So I talked about the expression of One Health in looking at things like our health systems and surveillance, about things like integrated digital health and evidence and prediction, and particularly in this case, big data. All right, so I can give an example there. If you're thinking of communicating this to policymakers, you want to think about showing how big data is important for making national level decisions, for making policy regarding the way in which a country should invest in energy, renewable energy, and other issues. Because here you'll have human big data, you'll have animal big data, and also plant big data. And this is one thing that I want to keep emphasizing. The plant big data is perhaps maybe the game changer here. You know, you want to think about things like gender, community, equity, and ethics. Now, there's a role for One Health there in expressing One Health through gender, community, equity, and ethics. So, and I can go on, but what I'm only trying to point out is that in our view, to bring policymakers and leaders along, we have to move away from this way of presenting One Health like is this one special thing where you have to insert it into your already existing milieu, but really to see it as an integral part of planning, and really that it gives you good results, gives you good outputs from a sustainable viewpoint. And this is always a challenge, the sustainability, because a curve can always go up at a certain angle and change at a certain point, or plateau at a certain point. The question is, at what point does this happen? So that they weave these decisions into very basic legislation and decisions that go beyond just political decisions which will express themselves within the lifespan of an elected government, to one that really is sunk or embedded within a national fiber.
Thanks, John. And I think what I'm hearing from you is we want One Health to be just like air. You know, it's just around and it's natural, and it's the air that we breathe daily, and it gets manifested in our decisions, whether they're decisions in WHO or decisions in our daily life.
Lorenzo,
because
you just sparked my mind there, right there. Sure. You know, and this is the point, and perhaps maybe a danger, but who knows? When someone will say, well, I can't handle it. What you're saying, I cannot put a shape to it. I cannot put a concreteness to it. But this is exactly what it is. It becomes like air. It becomes natural. It becomes normal. You cannot see it, but you express it. We live it, and we do it. And this is really the point where we want to get, where One Health becomes almost invisible in a way, but becomes our natural way of doing things. It's much like, let's say, public health. Public health only becomes visible when there's no trouble, when there's no problem. If public health is working well, you'll hear nothing. That's exactly.
It's invisible, and then you only recognize its importance when COVID-19, something like COVID-19,
that's right,
shows up on your doorstep. We only have 2 minutes, and unfortunately, that's all the time we got. We have so many more questions. We're actually taking note of those questions. Very important comments about the role of current political institutions, but is there a need for new bodies or agencies to advance One Health? Or what is the role of people who work in urban design, the built environment? So we didn't even touch on that. So there are many exciting questions here, and that just shows how ignited our audience is. In spite of the despair and the crisis that we're facing, everyone is so excited for a One Health future. But as I've already mentioned earlier, this is just the first of a series of webinars about One Health brought to you by the Lancet One Health Commission. I encourage you to visit the Commission's webpage at the University of Oslo's website for future updates. And feel free to reach out to any of us, tweet us if you have additional comments or suggestions or questions. Again, this is a process of co-creation that we're doing in the Lancet One Health Commission. Again, thank you, Andrea, and thank you, John, for your time. Thank you to our hundreds of audiences from around the world. Thank you for joining us. Please remain healthy and safe, and see you next time. Goodbye.
Thank you, Renzo. Goodbye.
Thank you, and goodbye.
Thank you.